it sounds cheesy, but I almost feel honoured to have been a part of it. So many people get scared of medical advancements, but if you don't take the chances, how the hell are we going to know that things work? How are we going to find out the answers? That's the whole point in taking the risk. You don't get the answers if you don't take that risk. So, and this is a massive thing that will affect the whole country, if not a knock-on effect to the rest of the world, if we become the first that really implement into place.
I'm a sickle cell carrier, and so is my mum. It then made us have conversations where we started to realise that actually, even as carriers, it's good that it's been highlighted now, because there could be so much more that's done. It's that for me personally, that's been a very kind of interesting side of it because of how personal it is. I'd hope that it's going to end up being something that is seen in the future as a positive, and we get to see what those outcomes are going to be as well, because obviously being a part of it from the beginning, it would be nice to see how it's gone from the beginning to seeing if they've actually taken our decisions on or advice on board. Because when it comes to championing things like this, as normal people, we're the most likely to be able to speak about this in the future and say why there should be groups like this, and say why actually this is a great idea. Let people do the research, because we were once part of this and we've seen good come out of it, and it can be done in the right way. Because I think at the moment there's so much distrust of the government that if we have tools in place that can show that real people have been involved and can also help, I think that'd be great.
They obviously take all our opinions on board and go with it. Really, I want it to be sent out to the public, to be shown. Like when I mentioned this to my mum on the phone and my partner, no one really knows about it. My mum had heard of it, obviously having kids, but no one really knew the full depth of it. So I think we should really just be letting people know.
We know that there's going to be a report that's going to be done. And I think knowing that we've been a part of a system that could eventually benefit us in the future, like I can imagine maybe having kids in the future, and this would be something that then would be normal.
Like anything that you're going to be doing new, there is a lot of concerns that come along with it, but this can benefit the whole population, starting with newborns, and could get rolled out into other age groups or vulnerable people.
The more we can be more open-minded, the more research will get done, the more we'll all become informed, and the more it will become the norm.
Like, this is something that could be phenomenal if it's so long as it's done ethically.
I was in hospital in labour with her, and she was on the Zoom calls with us. This is something that could benefit her and her children and her children's children. So it's really exciting, and I jumped at the chance to be a part of it.